By far, you are quite acquainted with granulomas, and you know that granulomas are found in several diseases. Now, some of them are known, and some are of unknown etiology. That may suggest an irritant or immunological origin. Obviously, I cannot discuss all of them here, because that requires a lot of patience from your side and a lot of energy from mine. So, making it easy for both of us, I am mentioning few of them. Starting off with a much familiar granulomatous disease, tuberculosis, because worldwide, it accounts for the highest proportion of adult deaths from infectious diseases. Its causative agent, Mycobacterium tuberculosis, is an oblivate robe that can exist within macrophages. The bacterium initially enters through the lungs, where it actually triggers a granulomatous inflammatory response. Now, the granuloma in pulmonary TB or tuberculosis is known as a gone focus. The infection is usually contained by the granuloma, though latent infection is common. What happens in the case of immunodeficiency is that the primary infection may not be contained within the lungs. It may cause widespread disease, or in latent disease, residual bacteria may reactivate and spread to other areas of the body. Now, the important point. Granulomas that are found in tuberculosis are large circumscribed granulomas, consisting of epithelioid cell, with central caseous necrosis and an outer layer of lymphocytic cells. Next up is sarcoidosis. Sarcoidosis is a multisystem granulomatous disease. It is typically characterized by the development of non-caseating epithelioid cell granulomas with no apparent cause, while the suspicion is that an infectious pathogen is a trigger for granuloma formation in sarcoidosis. While the lungs are the most frequently affected organ, it is seen in about 95% of patients. Well, the granulomas may appear throughout the body, particularly in the skin, lymph nodes, eyes, and liver. An interesting feature of sarcoidosis is a profound deficiency of other cell-mediated T-cell immunity, and often an increased level of immunoglobulin and antibody responsiveness. Now, next we have Crohn's disease. Crohn's disease is also called regional enteritis or ileitis. It is a lifelong form of inflammatory bowel disease, or IBD for short. It inflames and irritates the digestive tract, specifically the small and large intestines. Well, regional ileitis, or Crohn's disease, is somewhat similar to sarcoidosis, but usually restricted to the intestine. It is associated with pronounced T-cell infiltration into the intestinal wall, and hence was thought to be due to autoimmunity against gut proteins, perhaps stimulated by cross-reacting bacteria. Non-necrotic granulomas are one of the histological hallmarks of Crohn's disease, though they are not universally present. Often, the granulomas in Crohn's disease are associated with a more severe Crohn's disease phenotype. Well, the presence of granulomas may help you differentiate Crohn's disease from other inflammatory disorders of the bowel, such as ulcerative colitis. Ulcerative colitis is also an inflammatory bowel disease where the colon and rectum become inflamed, and it has quite similar etiology to Crohn's disease. Crohn's disease and ulcerative colitis have many things in common, and that is the reason we always get confused between the two. So, to help you out, I'm going to make a video on their comparison soon. So do visit us on sqadia.com to watch that. Next up is the primary biliary cirrhosis, which is a rare autoimmune disease. It is chronic and progressive cholestatic disease of the liver. Here, the granulomas are formed around the bile ducts, and the disease is believed to result from cross-reaction between a bacterial antigen and a mitochondrial self-antigen. Now, temporal arteritis. It is a chronic inflammatory disease of arteries with granulomas in which giant cells are prominent. So, this is also known as giant cell arteritis or Horton's arteritis. The temporal arteries, that are the blood vessels near the temples, which supply blood from the heart to the scalp, are inflamed and constricted. We have a complete video on giant cell arteritis on sqadia.com. So, do check it out. Well, another condition is eosinophilic granuloma. The name is suggesting that it has to do something with eosinophils. Yes, we got it right. Sometimes, eosinophils outnumber the other cells in a granuloma, hence called eosinophilic granuloma. This is particularly seen in worm infections and in rare bone conditions. Lastly, we have chronic granulomatous disease, or CGD for short. Well, chronic granulomatous disease is an immunodeficiency disease that is characterized by a defect in granulocyte function, which leads to chronic bacterial infection and, obviously, a granuloma development. So here it brings us to the end of the video. I hope the video was helpful for you. And you must be aware of chronic inflammation, granulomas, its types, associated diseases, and much more. To assess your knowledge gained thus far, I have a short quiz for you. So, let's do it with me and be confident on your learning. A 7-year-old girl presents with the chronic granulomatous disease. What is the possible defect? Option 1. Inability of polymorphonuclear leukocytes, or PNN, to ingest bacteria. Option 2. Reduced levels of the fifth component of complement. Option 3. Dysgammaglobulinemia. And Option 4. Inability of polymorphonuclear leukocytes to kill already ingested bacteria. So, which is the correct one? Yes, Option 4. Inability of polymorphonuclear leukocytes to kill already ingested bacteria. My next question is, which of the following cell types are typically seen in chronic inflammation? The lymphocytes, macrophages, neutrophils, erythrocytes, plasma cells. Correct answers are lymphocytes, macrophages, and plasma cells. Now, in which of the following are granulomas typically formed? Option 1, tuberculosis. Option 2, leprosy. Option 3, fungal disorders. Option 4, foreign body reaction. Option 5, gastritis. Option 6, appendicitis. Option 7, sarcoidosis. Quite easy though. Yes, all are correct, except gastritis and appendicitis. Heading on to the next question. Chronic inflammation is characterized by which of the following? Tissue destruction, angiogenesis, infiltration with neutrophils, fibrosis, or increased tissue concentration of lymphocytes. Here, again, all options are correct, except Option 3, infiltration with neutrophils, because neutrophils are associated with acute inflammation and not the chronic one. Now, the last question. Foreign body granulomas are formed if the foreign agent is Option 1, large. Option 2, inert. Option 3, antigenic. Option 4, non-antigenic. So, you marked your answer. Option 1, 2, and 4 are the correct ones. The foreign agent must be large, inert, and non-antigenic. Well, that was about chronic inflammation and granulomatous diseases. I hope all of you must have done a good job in quiz. If yes, then congratulations. You are good to go. But if you were not able to find the correct answers, worry not. I will suggest you to skim through the video once more. Or you can download the PDF notes of this video for your revision, only on sqadia.com. Goodbye.